I have extensive experience both as a healthcare professional and as a patient. I understand the current healthcare struggles from all perspectives. I had cancer 3 times recently over a 2-year period, and I experienced a complication from my first surgery, resulting in permanent unattended consequences. I saw a total of 37 doctors during that time. And after a long period of constant health issues, on October 4th, 2022, I showed up for what I thought was finally going to be a routine imaging visit and a welcomed opportunity to see my wonderful radiologist. And it was anything but routine. Another mass was found that day requiring yet another biopsy. This time it wasn't cancer, but my doctor wasn't there. And when I inquired as to where he was, I was told that he died a month ago. And I couldn't believe it. I asked what happened. They said they didn't know, and I fell apart. I have permission to share that he died by suicide. And
Oh,
since then, I've felt called to address physician well-being. It truly feels like a calling. And approximately 400 physicians a year die by suicide, and that's twice the national average. So that's the background. So getting to the second part, as far as some of the factors affecting physicians and other clinicians these days, is I have a couple points to share, actually from this month's Journal of Healthcare Management. And some of the points that in that article, in the study, are doctors and other clinicians are experiencing levels of distress that put their health and the health of the greater population at risk. More than half of physicians and other healthcare clinicians are experiencing symptoms of burnout. Along with increased turnover and reduced job satisfaction, burnout is associated with poorer patient outcomes, and that's why it should matter to all of us. If you're seeing your physician and they're disengaged, you're not going to get the care that you could if your physician was well. And there's a couple of terms that you might come across, you might be familiar with, or you might not, or you might come across in the future. And those two terms are moral distress and moral injury. And physicians and other clinicians now are suffering from moral distress, and that's knowing the correct clinical decision, but being prevented from making it because of internal or external constraints. And one example of that would be, I hope that you guys haven't experienced it, but some patients might, like their doctor might know the medication they want to put their patient on, but it's so expensive and insurance doesn't want to pay for it, and they have to try 3 other medications first. And it's frustrating for the physician, and it's frustrating for the patient. And sometimes that could be like what they'd refer to as death by 1,000 paper cuts, right? It just, the doctors get so frustrated when this happens over and over and over again. And moral injury was initially defined for military service members as conducting, witnessing, or failing to prevent actions that challenge sincerely held moral, religious, or ethical beliefs. Now also includes the experience of betrayal by authority figures in high-stakes situations. And I'll give a very general example that's happening right now with somebody I know. Their husband really needs a biopsy, but there's something going on. Again, the resources are limited between clinician resources, material resources, and they don't have handy what he needs for this biopsy, and he has to wait. It'll be 6 months by the time basically he has this biopsy after he had these elevated numbers. And it's very possible it can affect his outcome and even his life. And his doctor is very frustrated, but there isn't anything he can do about it. So that can be that moral injury. Um, and decreasing burnout and increasing resilience in clinicians has been the goal of many workplace programs. However, the focus has been on individual practices. They're telling the doctors, do more yoga, meditate. And although those tools can be part of a good wellness, individual to help all of us feel healthier, the reality is it's really mostly systemic contributors, including work overload, limited resources, administrative burdens, workplace culture, and negative leadership behaviors. And the last point I'll share to this is that medical licensing laws typically require physicians to disclose if they have received mental health services, resulting in real or perceived barriers to distressed clinicians seeking help. They don't want it on their license. Sometimes if it's marked on their license, someone doesn't want to hire them. So those are all issues. And to pile on to that, there's disruption of sleep patterns, when they have to take call. Or even, they've worked a long day, they finally get to bed and they get paged because someone's potassium is a little off and the nurse doesn't realize that could definitely wait until the morning. So they're showing up exhausted. And also they neglect their personal and their family needs. They've been taught since medical school, the patient comes first, and it just adds insult into injury and it piles up. And actually I'll share a quote from a physician who recently sent me a private message on LinkedIn, and I'm not gonna name him because I asked him this morning if I could use his quote, but I don't think he was on LinkedIn today, so I don't have permission to share his name. But he said, I don't think it would be an exaggeration to say that if you were to ask the vast majority of doctors in a moment of honesty, we all have really gut-wrenching stories about the toll medicine has taken on us individually, not just collectively. So that was a little background on some of the issues facing physicians today. And now we'll get right into the article, 10 Things to Know About Your Doctor That Will Get You Better Care. So this Dr. Don Sears and I had Zoomed together and we had a conversation about these things. And then we decided to collaborate on an article for Kevin MD, because sometimes if doctors try to talk about these things, it seems like they're like selfish or whiny or lazy. But if you collaborate with a patient and I say, hey, yeah, I really understand that, and we share our voice together, it can make a greater impact. So she came up with these, and I wrote an introduction for the article. So I'll read each of her 10 points one at a time with an action point, and then I'll also give my perspective as a patient. So number one is let the pilot fly the plane. Passengers generally don't walk onto an airplane and start complaining to the pilot about their seat assignment, the price of the ticket, or how their luggage was lost 6 years ago. We understand that the pilot's job is to fly the plane, with different people being charged with the other tasks. Physicians should not be held responsible for the entirety of patients' healthcare experiences. Perhaps it's a remnant of days gone by when physicians actually owned and ran their practices. Now, well over 50% of physicians have become employees, and their job is to provide physician care. Physicians are part of a team, with each member having narrowly defined roles. So the action step for this is to talk to your physician about the actual medical issue that brings you to see them that day. And one example I've seen myself is sometimes like somebody will give a patient, doctor a 1-star review because they had trouble finding a parking space, when that has absolutely nothing to do with the physician, and the physician has no control over that. Or if you're frustrated with your insurance issues, our time is already so limited with our doctors, often, 15 to 20 minutes, that you're basically shooting yourself in the foot if you're not using that time to share with the doctor why you're there and what your concerns are. So if you have other concerns about, parking, about insurance, about the nurse, even things like that, every office has some kind of manager. They might be called a practice manager or something else. So it's appropriate for you to share your concerns. But if it's not related to a medical issue, share it with the appropriate person, and you're more likely to be satisfied and get some results. So the second one is the average physician panel is 2,000 to 4,000 patients. The Grand Ole Opry in Nashville has 4,000 seats. Every day, a single physician is expected to be available for all their patients' individual needs and requests. Let me see. Sorry, I saw a thing in the chat. When a patient sends 3 urgent requests for a prescription they ran out of yesterday, it creates a situation of lack of planning on your part should not constitute an emergency on the physician's part. So the action step here is please plan ahead, make a single request if needed, and allow several days before reaching out again unless it's truly urgent. Because each of us, when we have an issue, of course, it's very important to us, and we are us. Most people would have no idea that doctors really do have 2,000 to 4,000 patients, and they can get hundreds of messages, every day. But from our perspective as a patient, I could say, as far as that prescription thing, I can give an example from my perspective, is that I'm on a cancer medication and I was having reactions to it. So we went back and forth. We tried a few different ones, and my medical oncologist and I decided, even though the standard of care for this medication is 20 milligrams, I seem to tolerate 10 milligrams okay. So we decided that it's better if I stay consistent on 10 than not be able to tolerate it all or have to keep switching medications. So what I was taking 10 milligrams twice a day. So I showed up at the pharmacy I have other medications because of that complication that I briefly mentioned in the beginning. And they wanted to give me twice the amount of medication I needed. And I'm like, I don't want to stockpile this. Plus, I have to pay for all these medications, right? Like all of you. So I said, look, and I explained the situation, but the doctor's office hadn't sent the change to them. And they were saying, no, insurance is making us like that. They said they had to give me the amount that was on there. And I'm like, this is ridiculous. And then plus they want you to get 3 months at a time. So I said, look, why don't I just refuse and tell you I'm only going to take 6 weeks worth? And by then I'll see my medical oncologist and I'll make sure that the direct prescription goes through. And she checked to see if they could do that. And they said, okay. So from that perspective, what I'm sharing, and I like to share specific examples because I know it helps me. It's like, take home messages. So what I'm basically saying to you is don't give up. And if it's, something that's happening like that, just try to find the person that can give you the answer that you're looking for. And if I hadn't had luck there, I could again call the practice manager. I've had a couple other experiences where I couldn't get through to schedule appointments, with the various physicians. And I finally found out that there was like a central scheduling number for my local healthcare system. And somebody always answers that, but most patients don't even know that there's a central scheduler, and they can schedule everything for me from my scans, to doctor appointments. So just keep asking and don't give up. Okay, so the third is realize that physicians and all healthcare workers come in all varieties. Patients will regularly encounter women physicians and male nurses. Women and physicians of color are often incorrectly assumed to be non-physicians. As a female physician, Dr. Sears is constantly asked, "Are you the real doctor? When will the doctor be here?" When physicians have to justify and defend their role, it wastes valuable time and creates a barrier between the patient and their physician. So the action step here is simply ask the healthcare worker to clarify their role whenever you aren't sure, as opposed to making assumptions. And I could say kind of conversely, or from a patient perspective, that also they should be identifying themselves to you. And if they don't ask, there's been plenty of times that I don't know who's taking my blood or my blood pressure. Are they an aide? Are they a nurse? And sometimes they don't say their names. And me as a physical therapist, I worked over 30 years, and I can tell you, I can guarantee you that there was never a time that I did not walk into a patient's room and say, "Hi, my name's Kim Downey. I'm a physical therapist and I'm going to be working with you today." And I showed them my name tag. In my last 7 years, I was working at a school. And even if I was working with young children on the autism spectrum and you don't even know what they understand, when I would go to get them the first time, I say, "Hi, I'm Miss Kim." I show them my, badge. I say, "We're going to play." I'm kind of like a gym teacher. But you deserve that respect. You deserve to know who's taking care of you. And if you're not sure who they are, ask in a respectful way. Okay. We're getting feedback from David. I don't know. Yeah, if it's affecting. That's what Nancy just said. There's still people unmuted. Um, okay. So number 4 is recognize that physicians are not AI robots, artificial intelligence robots. They have needs. They go home at night. They need to eat, sleep, and use the restroom. Their children get sick. They take vacations. They in turn will provide you with personalized healthcare, appreciating you as an individual, not a diagnosis. So the action is to acknowledge that physicians are human too, with human needs and wants. Now, you might think that's a no-brainer. Of course, they're humans. But it's okay if I share that quote from you, right, Pat? Pat shared a beautiful quote with me when we were just texting back and forth, and I think this sums it up. She said that I am giving a voice to doctors who are expected to be superhuman and not complain because of their salary. Many people don't have empathy for them because they think a doctor's life would be the ultimate. And doctors are really struggling right now. Medical students are struggling, residents are struggling. And I haven't mentioned again, I'll share a link at the end or for Pat to share. I recently started a podcast. It's called Stand Up for Doctors, and I've been interviewing 2 doctors a week. So I've dropped like 17 episodes so far. And in at least half of them, when I say, what would you like the audience to know about you? At least half of them literally say, I'm human. I'm a human too. My very first episode with his Dr. Todd Otten, he wrote this book called Ripple of Change with his patient Joshua Judy. And that's how he started my very first episode. He said, I have feelings, I have wants, I have needs. And I also have interviewed a retired anesthesiologist from Nashville. And he said the same thing. He says, I'm a person. People put us on a pedestal and they just think that we don't have families, excuse me, or that we don't need to eat or sleep. And he said, I put my pants on the same way you do. So they're humans that went to medical school and we need to see them as humans. So number 5 is know that physicians are likely the most highly trained individuals you'll encounter in any given week. And I will read this whole thing. She kind of went through the schooling that physicians have because on Kevin MD at the bottom, people can share comments, and some people had no idea the length of schooling that doctors go to, so they appreciated hearing that. So she said that doctors complete 4 years of undergraduate education, frequently majoring in biology or chemistry. All physicians must pass organic chemistry and physics and take a high-stakes all-day exam to prove it prior to entry into medical school. All physicians then go through 4 years of medical school, averaging 30 hours of classwork every semester. Many rarely see family and friends for years, even prior to residency. Then physicians go through residency, sometimes followed by a fellowship, typically lasting 3 to 8 years, working 80-hour weeks, being on call most holidays and many nights per week to fine-tune their skills before becoming an attending. Attending physicians have had over 20,000 hours of clinical experience. And the action is when you see your physician, know that they have a high level of experience. Don't be quick to discount their advice or suggestions. So speaking as a patient, I mean, I could give today would have been my dad's birthday. He died 6.5 years ago. He had diabetes. He died of pancreatic cancer. He was not the best patient, and he liked sugar. So here he is, on dialysis for diabetes. And when it got to the point that he couldn't drive, he ordered marshmallow peeps on the internet. So it's kind of fun. It's like sad and funny, right? Because but he would just think, okay, well, why do the doctors tell me I need this much insulin? And it's like, well, you're ordering marshmallow peeps on the internet. So if you want your doctor to take good care of you, you need to take some of the responsibility on yourself. And I can give you a personal example, though, for myself is during this period of time when I saw these doctors, I had a few poor experiences and I ended up switching out a few doctors. So at one point in the summer after my first surgery, I blacked out and fell, and I ended up with Lyme disease, a concussion, thoracic outlet syndrome, a whiplash injury, and a broken toe. But I'm sharing this is before I knew that I had that. I was switching to a brand new doctor who had never met me. And the day I went to see him, he thought I should have a brain MRI and an x-ray of my foot. But I had already been through a lot of things and I didn't want to do that. And I was like, well, I think I'm okay, and I declined. But then when I got home and I was having these symptoms and I was like, and my aunt had a brain tumor, and then I was like, well, oh my gosh, like what if I blacked out because I have a brain tumor? And I'm like, I should have a brain scan. And I'm like, well, that's what the doctor said, I should have listened to him. And then my toe, like with my foot was really, really hurting. So I'm like, well, I probably should get that foot x-ray. So I called back within 24 hours and he was awesome. He got the prior approval for what I needed. And I also, the other reason I did that was I thought if I'm establishing a relationship with this doctor, I want him to know that I trust him, and I have to trust him and I should trust him. And if you don't trust your doctor, we're in the Northeast, and other than if it's like a specialist, I know some doctors are hard to find, like specialists like for movement disorders or something, but we do have a choice. And I would say if you don't trust your doctor, then you should be finding another doctor. And if you trust your doctor, listen to them. And let's see. So the next one is patients are not airplanes. Every human is different and will react differently to treatment. Some people experience extensive rashes or life-threatening complications after a bee sting, while others simply pull out the stinger and go about their day. Every treatment has potential risks and side effects. Speak with your physician to make the best decisions together. And the action step here is don't expect your physician to have a crystal ball or to know things unless you tell them. Whenever you visit a doctor, bring a list of your current medications and diagnoses, as well as prior surgeries and allergies. And that's very important because again, my information is in more than one health system. They don't talk to each other. So when I was like reworking the medications with my medical oncologist, my other doctors are in other systems and they didn't know that. And then the other thing is, I don't know if you all look at your medical records, hopefully you do, like through patient portals, but things are wrong a lot. And also then once something is on, it seems to never go off. So if you like have that colonoscopy prep medication, which I did in the fall, it lists it like as an ongoing medication. And I'm like, well, thank goodness I don't have to do that every day, right? But then you have to tell them, no, that was like a one-time thing and I'm not going to take that again for 3 years. So especially if you're on multiple medications, it's understandable that you might not remember like the dosage and the frequency of every single one. Because again, there's some I take 3 times a week. There's some I take every day. There's a couple things I take more than once a day. So if you just always have a list with you to share with your physician, then they'll know what's accurate and current. Number 7, like a plane or a car, your body needs regular maintenance. When patients ignore their bodies, not providing good nutrition, active movement, or don't avoid harmful things, a physician can't be expected to fix them. Patients who acknowledge their role in disease and their role in healing have the best outcomes. And the action step here is don't expect miracles, expect to do some work. Look to your physician to guide you toward health and healing. So a personal example I can give you is because of my first surgery issues, I have kidney issues and chronic stage 3 kidney disease. And I'm on some medications for that. So I asked my nephrologist, now that I need a nephrologist, well, what can I do to protect my kidneys? And he said, don't get diabetes and don't get high blood pressure. So now I'm very careful, before I'm somebody who generally, like ate healthy and things like that. But now I intentionally would make sure that I don't have a lot of sugar. Because again, I don't want to get diabetes. I'm trying to protect my kidneys. And I try to do things as to not get high blood pressure and try to, keep my cholesterol in check, things like that. So there are some things, even though in some ways it's out of my control, we always have more control than we think we do. To feed our bodies the best we can feed them and to move, and to get adequate sleep and it's important for me to be hydrated. So just to do those things, to take care of your body the best you can. Help your doctor, help you. Right. Help yourself, help your doctor to help you. So number 8 is ongoing medical advances are mind-blowing. New medications and therapies are released daily. However, life expectancy in the U.S. is not climbing. Historically, the greatest amounts of medical resources are utilized in the last year of life. Can and should are not the same. More is not always better. So basically, just because you can doesn't mean you should. And these are truths in healthcare, especially in hospital settings. So the action is that it's critical to have realistic conversations with your physician and family members while you are able to speak to for yourself to ensure your wishes are honored. And an example I can give is I've also collaborated with another physician. Her name is Dr. Brittany Lamb. She's an ER doctor in Virginia. And she finds herself sometimes, because family members will bring a person in with dementia, whether they're, dehydrated, whether they've had a stroke. Obviously, anything that brings anybody to the emergency room can happen to someone with dementia. But if they're advanced to a certain level in dementia, they can't speak for themselves. And she finds herself forced, again, this could go back to even that moral distress or moral injury, to do things to these patients that she suspects they would not want done to themselves. And if it was her, that she would not want done to herself. But when family members are arguing or want anything done at all costs, she has to follow through with what the family members are saying right there. So that's why it's so important as far as advanced directives and things like that, is while you can speak for yourself, to get those things in place and to make sure your family members and your doctors know what your wishes are. And number 8 is not all medical records are shared. A physician doesn't know if you took a quick trip to your sister's house and experienced a gallbladder attack requiring surgery. Both patients and physicians must work together to keep records accurate and up to date. Simply dropping a car off at your mechanic without explaining the issues you are having will likely result in a basic oil change, not solve the underlying problems. So the action step here is to take responsibility to partner with your physicians. And a way I did this is, through all this complicated health history in my past few years, and again, I switched a couple of physicians out. So this primary care doctor is coming in the middle of all this complicated stuff. So what I did for him was, I had never done this before, is I wrote up my medical summary. So what I thought he needed to know about the first 55 years of my life was half of one page. But then since I had the surgeries and the cancers and the other things, I just did bullet points. So I put the date, the doctor's name, and what they said. So if I saw my nephrologist last, so I'd say Dr., whatever, 12/1/22, Dr. So-and-so, and that maybe he would have said, well, her phosphorus was too high. We're adding another Tums at dinner or something like that. So I put that in. So if I ever have a different nephrologist, or if I have a different primary care doctor, if I'm going to a different system, I can always just actually bring that with me. And so 2 of the doctors that I switched out, and the first 2 that I shared that with, they thanked me more than once, and they said it was incredibly helpful. And even my own primary care doctor, who most of my doctors are in the same system, so he can go on and see that. But maybe, like many of you, it's so complicated and so extensive that for him to weed through all that for my visit could be pretty time consuming. But now I send it ahead to him, because I keep it running on my computer. So then he sees me every 6 months. So then I'll just send him from the past 6 months, and it's just bullet points of every doctor I saw, the date, and what they said in a few sentences. And he really greatly appreciates that. And again, it helps you get better care. Well, because I saw one doctor who recently for a procedure that I needed to have, and I hadn't seen him since before any of the cancers, and he didn't know anything. And I had even sent the medical summary ahead, but he didn't get it. So it's good even to bring it with you when you're going to see a new doctor, because we had to, quote unquote, waste a lot of time for me to update him, because it was critical information that he needed to know, for why I was there. So that's actually very important, and the doctors appreciate it. And again, it helps you to help them to help you. And then the last, number 10, is everyone deserves kindness. A simple thank you for all you are doing for me goes much further than a box of donuts. The action is consider sending a Happy New Year card to each of your physicians, or a doctor's day is March 30th. So your doctors would appreciate it more than you can possibly imagine if they got a little note from you that you acknowledged and actually knew it was Doctor's Day. As she says, write a thank you note to them, letting them know that you're aware that many physicians have left medical practice over the past couple years. Over 10% have left. That you genuinely appreciate them and that you're glad they're still providing outstanding health care to you and your community. And now whenever I get good care anywhere, I send a thank you note, and I had sent one to my dental hygienist, and I think she literally told me it made her whole month, because nobody thinks, sometimes you don't, you might think to thank your surgeon, but you might not think to thank your anesthesiologist, right? Or, there's other people that are unsung heroes in cancer treatment, or even in your own health journeys. When you go, you interact with different people, and you might have a really lovely medical assistant that goes above and beyond and makes you feel really comfortable. And that just helps. Gratitude goes a long, long way to helping them feel supported. So those were the 10 things. Before we move on to questions or anything, I'm adding my own number 11, because it's, from personal experience. This would be very helpful to share with people. So, is my opinion is to always get a second surgical opinion. If you ever need surgery of any kind at all, even if you have a doctor you trust that says, I send everybody there, or I'm going to send everybody there, it's trusting that doctor, even if you like that one, in a way that's excessive and not fair to them. And then you're not using your own best judgment because you don't have anything to compare it to. So if that makes sense, and if you need me to clarify a little bit, I could do that. But I also want you to know that you should always attempt to ensure that you've had true informed consent. So when you're going to have a surgery, actually ask that when they go through the list of complications, if they tell you a lot of things in one sentence, say, wait,
I can see you. See, yeah.
Say, I want to understand these things, and say, or what are the chances that this is going to happen to me? And make sure, say, have you gone through all the complications, and anything that's really is a significant risk, or something that could affect me every day for the rest of my life, that you want to make sure that they've covered all of that and gone over it with you. And the last thing I'll say is how I end my podcasts is when I interview the doctors, and I have recently interviewed a patient as well. I'm going to interview different people that intersect with healthcare. Is I say in closing, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors. So, and then I can be reached. So I guess I'll send Pat an email in the end. So I have a YouTube channel, and it's called Stand Up for Doctors. And that's where I speak to the most wonderful doctors talking about very interesting things. And then I have this Kevin MD author page where it lists all the articles that I've collaborated on. And again, I think it's very interesting for doctors and patients. And I'm very active on LinkedIn if any of you would like to find me there. And then Pat is free to share my email address. It's kimdowney84@gmail.com if any questions come up that we don't get answered tonight. So Pat, I'll let Pat take over now. So I don't know if she wants to tell people they can unmute, or if there are questions in the chat, or how you want to go about this.
I was trying to unmute. Kim, thank you so much. If anybody has any questions, they can certainly ask you. And if there are no questions, I'd like you to talk a little bit about what happens when you, as a patient, have a problem with your doctor. You may want to keep the doctor, but you have a problem with the doctor.
Sure. Well, okay, did you want me to speak to that first or take questions?
I think you should take questions based on what you've said, and then we can go there.
Okay, sure. Well, was there questions in the chat? Let's see. Uh, I think the chat questions were more about the muting and stuff. Right? I don't see any questions in the chat myself. No, I don't see any.
Does anyone have any questions that they didn't write in the chat, but they would like to ask him, or any concerns or anything that they'd like to address?
Oh, Steve, I think is talking, but he's muted. He's still muted if he's trying to talk to me. Steve, are you trying to talk to me, to us? Because you're muted.
Wilson, do you have any thoughts,
Okay.
any questions?
Can you hear me now?
Yes.
What list were you reading from? Beginning.
For you mean the 10 points?
Yes.
The 10. So this is an article I collaborated on with Dr. Don Sears. It's called 10 Things to Know About Your Doctor That Will Get You Better Care. And Kevin MD is social media's leading physician voice. He publishes 5 articles a day and does a daily podcast, 15-minute podcast. He's been doing this for many years, where a lot of doctors submit articles, but patients can submit articles, lawyers, anybody can submit an article. And he published this collaborative article that I wrote with Don Sears. He published it on November 29th, 2023. So when I send the link to Pat, I can send her a link to my author page. But if you went to kevinmd.com and there's a search feature, and if you type in my name, Kim Downey, my articles, about 11 or 12 will pop up, because he's accepted a couple other ones, and the one is what we'll speak to about crucial conversations, but they haven't been published yet.
Okay. Thank you.
Sure. So I hope I didn't go too fast, because we took the whole hour to go through that the first time. And I'm also interested in your feedback. So either if you wish to share it now or later with Pat, so I can make this as effective as I can. So I don't know if anyone has any feedback that'd like to share, or they could share it with Pat or Wilson later.
Well, Kim, I just want to point something out. I know you said something with a medical summary, right? It's amazing that a few years ago I had to get the medical summary for my private insurance company, because they required it for my disability, right? I was amazed that from my neurologist, what he wrote every time I went, the hour I was with him. I was like, I never seen a medical summary, never was curious or for whatever reason about it until like I said, my insurance company required it, and I got it, and I sent it to them, and I read it, and it was like, wow! I was like amazed how much information is there about you, and you are right about some things. I didn't find anything wrong, but I found things that kind of like twisted the things that I said around a little bit, maybe because typing fast or whatever, or maybe he forgets afterwards. But it's important to, like you said, you pointed out that it's important to look at your medical summary just in case something I missed there.
Right. And if any of you haven't accessed your patient portal or don't know how to do that, you can call your doctor's office and tell them that you want to have access to your patient portal, and then you can see. And that's actually how I found out that there even was a patient portal, because again, my cancer issues go back to November 2020. And before then, I was walking around minding my own business, seeing a gynecologist and a primary care doctor once a year, right? I had no need for a patient portal, and I didn't think they weren't so even active that back then. But I was referred once things happened and I needed a nephrologist. I went, and I wasn't, he sent me for some tests, and I wasn't getting the results of those tests. And at that point, I was kind of scared. There was a scan and a lot of lab work and stuff like that. And so it was a friend that told me, well, you can just go see the results on this patient portal. And I had no idea. So then when I went on, I saw that. And now I do check, like after I have a doctor appointment like that night or the next day, I go and see what they wrote. And like you said, well, so, I mean, so I know you said that yours was pretty accurate, or that sometimes, yeah, that they take the subjective part and you're like, I didn't say that, or that's not the way. And you're entitled to accurate medical records.
Yeah, and I was surprised too how much information is there that he wrote. And you sit in front of him, but you don't see him writing things down. I mean, you see him typing a little bit, but afterwards you see a whole sheet worth of information. That did I really say all this? For an hour? I was surprised. Only because of the insurance company required it. Otherwise I would have just passed by it. Just
Right.
overlooked it. And
Right.
also, another thing I do when I go to the doctor. I don't know if you, I know we all need our medicines, right? But when I go to the doctor, when a neurologist specifically, because I've been taking medicine, since I started Parkinson's, 12 years ago, whatever. So, and every time, as time goes on, Parkinson's keeps getting progressive, right? So, you go to the doctor, gives you more medicine and more medicine, more medicine. Now my mind says not to go when I go to see a neurologist is to get less medicine to weed out the pills, right? And I don't know how many people do that, but every time I go to the doctor, it's like, hey, something's wrong with me, doctor. I feel this. So go. So it's not a prescription, right? And I go like, I don't want more medicines. I keep my remembering if this current medicine is doing anything for me. So I go to him and say, well, this pill's not doing anything for me anymore. Could I stop taking it? He goes, okay. So I got rid of like about half the pills I've taken in the last few years, using that method. Just tell him, what's working and what's not working.
Yeah, that's a very, very important point, and that was a way that you worked with your doctor, because it's both things are true at the same time. Like on one hand, you don't want to just take, like if your doctor just keeps wanting more and more medicine and you don't want that, shouldn't just blindly do every single thing, right? If it's not what you want to do in your heart or what you don't feel is best for you. And then conversely, you don't want to do what I did without even, maybe giving them a chance to say, no, I don't want to do those things, right? Like if they have a good reason for it. So it's partnering in conversations. And I know even with my nephrologist, now it's kind of like, well, I'm on, well, relatively speaking, like a younger end, right? As far as like, I might have to go on dialysis at some point and things like that. And I don't want many medications too soon, but then if they're too low, then I have symptoms or I can black out, like because he thinks it was a cardiac arrhythmia due to low calcium because I was trying to reduce my medications too low. So we had a discussion about it, and then we decide together, what I should be on and what the dose is. And that's exactly what you did, Wilson. So that was really great. So it's really important to question anything. And if you say, because different people have different priorities. And, for me, like my nephrologist knows that my priority, I want to be on as little medication as I can. And I thought if I could minimize one, that I could get off a couple other ones. But for me, that didn't work. For you, it did. But just if they know that, because other people would rather just be able to, whatever, eat what they want, do what they want, and take more insulin or take more this or more that. They don't really care. It depends on what your priorities are, but to have a discussion about that with your physician.
Yeah, you can always go back to it if you feel like you need it again. You can always go back to it. It will happily be given it to you again. So,
right.
So it's a win-win. I think for the most part.
Exactly. Did anyone else have any questions? Okay, so we have a few minutes. So actually, another article that I just collaborated on with an ENT surgeon in Nashville. Her name is Dr. Frances May Harden, and she had a very traumatic experience in residency. There's a lot of bullying and shame in medicine, and it can be very, very difficult. And she had a poor experience, and she wants to help other residents, and she doesn't want other residents to go through what she did. So she has a website called like Reimagining Residency, and she tries to put a lot of resources on there that will help residents. And when I had a conversation with her, we talked about that residents need to have crucial conversations, and physicians with their patients all the time. So a crucial conversation is defined by as a discussion characterized by high stakes, differing opinions, and strong emotions. And we all have crucial conversations throughout our lives, and doctors in particular have them all the time, including with their patients, bosses and colleagues, and friends and family members. And how you prepare for and speak and respond to a crucial conversation makes a huge and lasting impact on the outcome of that interaction. So we just collaborated on an article, and it's really for anyone teaching you some points about how to have a successful crucial conversation. And that's kind of what Pat was speaking to. So, so in planning a crucial conversation, so say you're going to talk to your doctor, you're not happy with them. So you want to start by determining your motive. Like, what do you really want out of the conversation? Keeping that in mind will help you show up for the conversation in a way that you'll be satisfied with no matter the outcome. So if you just thought your doctor was like the most horrible person ever and you don't really care and you just want to go and blow off steam, if you know that that's your motive, that's fine if that's your motive, right? But you don't want to go and keep, like, what if you want to keep this doctor, or if you don't have choices, say it's a doctor that you don't have a lot of choices and they might not be your favorite, but you need them, right? Then you might want to think about that conversation a little bit differently, right? Because you don't want to burn any bridges. So another thing that's important is to determine the facts of the situation versus the story that you're telling yourself about the situation. Facts have evidence to back them up and can be substantiated. So for instance, from a doctor's perspective, because they can tell themselves stories and not differentiate between fact and story. So the example I gave in the article was, a fact would be, my patient did not pick up their prescriptions. This is in contrast to a story that might run through the doctor's head that my patient must be lazy and not care about their health, right? That's a story, because what if the patient didn't have a ride to the pharmacy? What if they were afraid of taking the medication? What if they had a lot of family issues at home and couldn't get to the pharmacy, right? What if they're it could be any, what if they couldn't afford the medication, right? So the fact is they didn't pick it up. Then there's things we tell ourselves stories. So we're better people and better doctors when we routinely and clearly differentiate between fact and story. So that's something you can have in your head before you talk to your doctor. And another good question to ask yourself when planning a conversation is, why would a reasonable, rational person act this way? So I had, a couple doctors that I didn't have a good experience with, so that I could think in my own head, well, are they burnt out? Did they just have too many patients? There could be a lot of reasons, but it just brings you to a different place if you try to think of that and try to put yourself in the other person's shoes. Because the better prepared you can be for these conversations, it'll only help you. And the other thing is to find a mutual purpose whenever possible. Is there a common denominator beneficial to all parties? The ability to maintain that vision during the conversation can serve as an important guidepost. So for instance, if you want your doctor to give you better care and you want to keep your doctor, that's some groundwork. So then you would be like, okay, it's worth it to have this conversation because our relationship is important. And when possible, ask permission. So again, because we all need to have crucial conversations with spouses, friends, family members, anybody, is if you're going to talk about something important, to ask, is this a good time, or when would it be a good time to talk about this? So you're not catching them off guard. And then they might be more open to listening what you have to say if they aren't really stressed out or in the middle of something where they might tune you out. And another point is to start with a heart and begin by stating your positive intention. And that's one to say, look, I was a little frustrated after our last visit. Either this did happen or this didn't happen, or you didn't follow through. And also if you can couch it in something positive, that can really help too. Like, thank you for, being able to order that medication for me after we tried all those other ones. I appreciate you taking the time to do that. And this happened. I was a little frustrated, blah, blah, blah. I'm wondering how we can figure this out. And thank you again for always looking out for me or something like that. And
Kim, do we have to make an appointment for that conversation, you think? Or do you think we can have it when we go for a regular visit?
well, my general understanding is that it would kind of have to be during a regular visit, because these days, like, doctors won't, generally speaking, from my experience, you can't just make an appointment to talk where you used to be able to. But now, like, they need action steps for this. So you can try, and if you have good luck with that, that's great. But in general, you just can't make an appointment for with a doctor to say, hey, I want to talk about like general things. Like, my understanding is it generally has to be for, health related things or for a regular follow-up. Unless you have, again, I know we're running out of time, but there's something called direct primary care or concierge medicine, where now people are paying directly, like the way it used to be in the 80s. You would go to the doctor and you would just pay them, right? So now there are those models, and those doctors, you could do that. And they're there, they have way less patients, and they're there for you 24/7. You have their cell phone number, you can text them. So in that case, yes, but for some other cases that might not work. If you just said, hey, I want to make an appointment to talk. And let's see. So so again, if you start with a heart and a positive intent, the intention is for the other person to be able to receive the information you're about to share from a mindset where they feel safe to listen and receive feedback without becoming defensive and shutting down, tuning out, or walking away. And the last point is to be transparent and sincere, demonstrating empathy, when having the conversation, given that the information you are sharing might be difficult to receive, and respond with compassion. So I wrote that for physicians, but it goes both way, or for anyone, no matter who you're having the conversation with. And then I go on. I know we're just about out of time, so I won't, finish going over the article, but we talked about specifically how doctors can have a conversation and offer an apology when something goes wrong. And I quoted a surgeon from a book that's a very good way that a doctor can have that conversation with a patient. And so I myself have had crucial conversations with some doctors through all of this. And the first few, I didn't really plan ahead. I didn't think to myself, oh, I'm going to plan for this crucial conversation. I kind of said in a polite, respectful way, but I didn't plan it ahead, and it didn't go as well as it could have. And it might have gone better if I had planned ahead. Then one time I did plan ahead and I wasn't happy with the outcome, but that just, my takeaway from that is that you can't control other people's actions or reactions. All you control is what you say and how you say it. You can't control how they're going to receive it. So if you showed up with your best self and you weren't satisfied, again, then you can make a decision. Do I want to stay with this doctor, if you have options? And then there was another time that I planned extensively, actually 2 other times, for the conversation, and I was scared to do it because I respected the doctor, but I showed up with my best self, and the physician did as well. And since I set that framework, for the talk, they were able to really listen to me, offer empathy, compassion, and even an apology. So it can go well. And then Dr. Sarah Whittrey, I ended this piece with a quote from her. She said, healing is in speaking our truth, validating our experiences and those of others. That rings true for doctors and patients, how we're all going to heal, right? Doctors need to share their stories, and we need to share our stories too. And when we speak our truth, it feels validating, and that's how we're going to move the needle in healthcare, is all of us hearing each other's stories and caring about each other.
Thank you so much, Kim. Any other questions? It is 6 o'clock and we don't want to hold anybody up. So I just wanted to thank you. Your presentation was excellent, and I'm sure everybody got something from it. And if you have any questions for us, you can always reach out. And if we have questions, I will certainly, oh, Shelley, do you have a question? Oh, okay.
Oh, okay.
If
So
any- if
absolutely.
it-
So Pat, what I'll do is I'll send you an email now with the links to what I said, to like the podcast, to the Kevin MD author page, my email address. And if anyone would like to give Pat feedback, any kind of feedback at all, because I really care about doing a good job. And if I'm going to be speaking to patients, I want it to be helpful and meaningful to them. So I would sincerely appreciate any kind of feedback. So, and,
Thank you.
and thank you very much.
Bye-bye.
Okay.
Bye-bye, everyone. Have a great night, and thank you guys for coming. Really appreciate it. Stay safe. I know the weather's bad. Stay safe.
Okay. Take care.
Take care.
Thank you, yeah.
Thank you.
By the way, John, you look like you're in a nice place. Where are you?
I think it's just the background.
Yeah. Oh, you think so? I see palm trees move. Don't you see the palm trees moving? Well, wherever you are, John, that's where I'd like to be right about now. He's smiling, so that's good. Anyway, I'm going for the night. Everyone have a great night, and thank
Okay.
you so much for
You,
everything.
you too. You
Thank you,
too. Thanks,
Pat.
Pat.
Night.